Hi, everybody. I hope everyone is doing well. This is Dr. Eliana Aaron from EMA Care. I'm here to review today's um, charts, numbers, some new regulations, and to just give you an idea of what's going on. I haven't reported in a few days because of Pesach, and I hope that everyone is taking care of themselves and following all of the restrictions. As of today, everyone is required to wear a mask when leaving their home. Um, I was in Jerusalem today. I'm a health provider. I'm allowed to travel. And a lot of people are not wearing masks. I confronted a number of them. I corrected the way people are wearing their masks. The mask legally must cover your nose and mouth. If you don't own a surgical mask, then everyone has to make a mask at home or at least cover their nose and mouth when they leave with a scarf or cloth or something. There are lots of videos how to make your own masks. My daughter has one made of a double layer of vacuum liner, like a vacuum cleaner bag liner. So she actually had to leave the house today and she had to wear that. Now, leaving the house is only for urgent issues such as purchasing food, medication, or medical appointments. Um, Emergency workers such as myself, healthcare providers, and other emergency workers as designated by the law are allowed to leave their home. Uh, and are allowed to go to work. So very important to keep to that restriction. You are allowed to walk within 100 meters of your home to get some fresh air, but you do need to wear a mask. So I'm going to quickly go through some of the numbers today because there's some good news and I just want to run through it really quickly. And here we go. So today you can see our total cases for today, and that's a cumulative number, is 11,145 with 402 new cases today. So basically what is going on right now is we are now doubling our rate every 12 days, which is really, really good. We're happy. Obviously, we want to eventually make that even more, but considering where we were only about 2.5 weeks ago, where it was every 3 days, I think it's very obvious that what we're doing is helping, but we must continue doing it. I'm going to quickly show you another really important screen, which is the critical cases and the deaths. So the critical cases is the daily report. This is a number, people who are critical don't change from one day to the next. But what we're seeing here in the last few days, here you have a significant upturn towards the end of March. Now you're seeing that it's really stabilizing. And we've had quite a few days where we've actually had a little bit of a lower number. Most people who are critical are recovering, which is really good. But of course, we do have the blue is the deaths. That's the daily rate of death each day. And so that is something that is what we believe is getting lower. However, we still have that. That is a number that is lagging, and that's normal to be lagging. We are not using even close to the number of ventilators, that we have in Israel. We have at least 2,800 ventilators without any of the new purchases that the government is making. And I think at the height, we had less than 150 people on ventilators. So that's a really good sign. Israel continues to prepare for a potential second wave, which, as I've said before, may be significantly higher than the first wave. So Israel is not stopping to make those plans, even though we seem to be stabilizing, because you always have to be ready for the next stage. And Israel, if anything, is ready. So what you can see here is the epidemiological curve. And that's the curve that, as I said, it goes up and it's supposed to go down to zero eventually. But what we're seeing here is that we're on a downtrend since April. We had an uptrend, which is related probably to Perm. That's what we're all attributing it to. Everyone got together, and unfortunately, that caused a very big bounce right about here, which happened between 1 and 2 weeks after Perm, and then the continued spread that happened until we started this more severe lockdown that we're in right now. So, so that actually is a decent looking chart. The other thing I wanted to quickly show you is here, the active versus resolved cases. So you can see here that we are starting to make headway. What we've had in the last few days is a significant upturn in the number of people who are recovered. And let me tell you, that's an amazing thing. Right now we have 1,627 people who've recovered. When you look back a week ago, we had only 546. So we've had 1,100 new recoveries in the last week, and that's a nice big bump. And I said before that the recovery bump is delayed because it does, when someone's recovered, it means they've had 2 tests that are negative. It does take between 3 and 5 weeks to clear the virus. And so it does take quite a long time. So we are now starting to see hundreds of cases. In the last 2 days, we've had over 200 official recoveries every day, which is really what we're looking forward to. And that's going to continue. Quickly going to show you the percentage of new patients. Again, on a downtrend. This is the number of new patients relative to the total number of patients that we've had. So again, we were up at around 18% a day over here on March 25th, and now on April 12th, we are all the way down here at less than 4%. So that's really good. And you can see that this bounce over here had to do with Pesach. The numbers weren't reported exactly on time, but what we're seeing here is a significant downtrend, and of course, we really like that. Now, a lot of people have been asking for information about the cities. So I'm going to show you the latest information about the cities, and I think it's really important to understand that we're having a still significant bump over here. It's a little hard to see Jerusalem. Jerusalem had a bump, and Bnei Brak as well. What we're also seeing, though, is that a lot of cities that had low levels of cases are starting to get what I call bumps or hotspots. And the government wanted to make sure that people understand why certain cities are being closed down and other cities are not. And so people were criticizing that only ultra-Orthodox cities were being shut down, and that's not true. And the government released today what the criteria are. So what it is when the number of people diagnosed with corona is 50 or more, or dynamically determined as being significant according to how things are developing. So if you go from 10 cases one day to 40 cases the next day, you're not at 50 yet, but that's a big bump, and you're going to probably have to lock that area down to prevent a crazy spread. Another criteria that they're using is when the rate per 100,000 residents is higher than the national average. So in cities like Jerusalem that have almost 1 million residents, the rate is actually going to be lower. Of course, Jerusalem has a large number of cases, so they're still on lockdown, but I'm trying to explain that the percentage, if you have, let's say you have 1,600 cases in Jerusalem, but you have 1 million people who live there, then that's not going to be a very high percentage. But in a smaller town, you might have a lot less people living there, and therefore less cases are going to be a higher percentage. So that's another criteria. And the third one is that if the rate of increase, and that's what you're seeing here in this chart, you're seeing the rates of increase over the last 3 days is higher than the national average. So they're tracking the national average, which again is going back to that first chart that I showed you, which is pretty flat line. We're doing pretty well with that. And when they see that for a 3-day change, which in the case of this chart is between the middle light blue and the dark blue numbers, if that percentage is higher than the national average, then that is a good reason to shut it down. And they're not waiting many days, they're waiting for a 3-day trend, and that's where they draw the line. So if they see that things are improving in those areas, they are going to stop the shutdown, and they're going to allow traffic to continue. So that's something very important to note. So some of the areas that we are particularly concerned with are, of course, Bnei Brak has had a 59% increase in the last week. Jerusalem also. They're both still in lockdown. Ashkelon is getting there at about 45% of an increase in the last week again. Elad is also a problem, and that's 67% increase. Or Yehuda is about 50% since the beginning of the measurements per city, which is about a week ago. Beit Shemesh is definitely a problem. They're at a 40% increase, and so what we're basically seeing, and there's a few others, but it's being monitored very closely. What we are seeing though is that certain areas like Efrat are stabilizing, and there's not a lot of new cases there. So, for example, like I said, we have Efrat is stabilizing, but we're also seeing that there are other areas that are doing a little bit better. So we are monitoring that very carefully, of course. So let me just quickly pull up the last one I want to share with you, which is the case fatality rate. Case fatality rate is a proportion, and this is a really great number to look at when you want to try to think about everyone asks, how is Israel doing compared to other countries? As far as mortality rate, and that's really the bottom line, is mortality rate is probably the most important indicator, because mortality rate is the number of people who die. So the case fatality rate in epidemiology is the proportion of people who die out of the people who've gotten sick. So if 100 people get sick and 6 people die, then you have 6% case fatality rate. Okay, so what you have here is the case fatality rate of the top countries, the countries that have the most cases in them, and what percentage of those cases are fatal. And you can see Israel is at 0.94% right now. It is important to note that there are certain countries, unfortunately, who are not reporting the mortality accurately. This has been reported across the board. Western countries generally are, but there are countries here, as you can see, that are not Western countries and not terribly developed, and they are reporting many fatalities that for people who have pre-existing conditions as being caused by the pre-existing condition and not by coronavirus. So it's changing their numbers. And this is believed to be definitely happening in China. And there's a high suspicion that this is happening as well in Russia. So when you look at these numbers, keep that in mind. But what we see here is that the world average is 6.17%. So 6% of people who get coronavirus die. So the countries that are below that number are countries that are considered to be doing well. Okay, Israel is way down on the scale. Remember, Israel is still considered the safest country in the world for coronavirus, and there's a reason why, and this is one of the reasons why. And the more dangerous countries in the world are actually, other than Iran, they're all in Western Europe, as many of you know, Britain had a policy for a short period of time of herd immunity, which is let everyone get it and whoever dies, dies. And it was an outcry, of course, but what we're seeing here is a very high mortality rate, and they're still really at their peak right now. Italy is quite past their peak, which is great. But we're starting to see some of these countries just getting to their peak now. Spain is also past their peak, or that's what it looks like statistically. So for those of you who have asked me how Switzerland is doing so well, please note that Switzerland has a 4.35% mortality rate and Israel's less than 1%. So even though they have flattened their curve, they still have many more deaths than we've had. So I want to keep that in mind. So overall, I think our government has good policy. Most people are keeping to the regulations. Police and army are shutting down roads. They're questioning people who are walking on the streets of the cities, like, where do you live? Are you 100 meters from your house? And they are giving tickets to people. So I have seen this myself firsthand. So we got to keep in mind that there are people who are trying to break the rules, and the government is setting up these roadblocks and things to keep people in line, because in the end, we all want this to go away and we all want to get back to normal. This is Dr. Eliana Aaron, Director of EMA Care. I hope everyone stays safe, stays healthy, and stays home. Take care.